Silcontrol contains the active ingredient sildenafil, which belongs to the phosphodiesterase type 5 inhibitors. It works by helping the blood vessels in your penis to relax, allowing blood to flow into your penis when you are sexually excited. Silcontrol will only help you to get an erection if you are sexually stimulated. Indications. Silcontrol is used to treat adult men with erectile dysfunction, impotence, defined as the inability to obtain or maintain a penile erection sufficient for sexual activity. Dosage. Always use this medicine exactly as described in the package leaflet or as directed by a doctor pharmacist. Check with your doctor pharmacist if you are not sure. The recommended dose is 25 mg. After consultation, the doctor may recommend a different dosage method. Silcontrol should not be used more than once a day. Silcontrol should be taken approximately 1 hour before planned sexual activity. Swallow the tablets whole with a glass of water. If you have the impression that the effect of Silcontrol is too strong or too weak, talk to a doctor pharmacist. Silcontrol will only help you get an erection if you are sexually stimulated. The amount of time Silcontrol takes to work varies from person to person, but it normally takes between half an hour and 1 hour. It may take longer to work if this medicine is taken after a heavy meal. Contact a doctor if you do not get an erection after taking Silcontrol, or if an erection is not long enough for you to have sexual intercourse. Contraindications. Sildenafil is not suitable for some people. To make sure it's safe for you, speak to your doctor pharmacist before taking sildenafil if you have ever had an allergic reaction to sildenafil or any other medicine. Are taking medicines called nitrates for chest pain, angina. Have a serious heart or liver problem. Have recently had a stroke, heart attack or a heart problem. A doctor should carefully check whether your heart can take the additional strain of having sex. Have low blood pressure, hypertension. Have a rare inherited eye disease such as retinitis pigmentosa. Have sickle cell anemia, an abnormality of red blood cells, leukemia, cancer of blood cells, or multiple myeloma, cancer of bone marrow. Have a deformity of your penis or Peyronie's disease. Have penis. Have a stomach ulcer. Have a bleeding problem like hemophilia. What to avoid? Drinking alcohol with sildenafil can cause side effects. Grapefruit may interact with sildenafil and lead to unwanted side effects. Avoid the use of grapefruit products. Avoid using any other medicines to treat impotence, such as alprostadil or yohimbine, without first talking to a doctor. Side effects. Get emergency medical help if you have signs of an allergic reaction to sildenafil, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Stop taking sildenafil and get emergency medical help if you have heart attack symptoms, chest pain or pressure, pain spreading to your jaw or shoulder, nausea, sweating. Vision changes or sudden vision loss. Erection is painful or lasts for longer than 4 hours. Prolonged erection can damage the penis. Ringing in your ears or sudden hearing loss. Irregular heartbeat. Swelling in your hands, ankles or feet. Shortness of breath. Seizure, convulsions. A lightheaded feeling like you might pass out.